Hello, Medicos. Good day to all of you. This is Dr. BK for you, and today I will be discussing about the nasal cavity. So, this nasal cavity I will be discussing in two parts. In the first part, I will be discussing about certain features about the external nose. Okay, so what are the bones and the cartilages forming the external nose? It's blood supply and nerve supply. Then followed by that, I will be discussing about the boundaries of the nasal cavity. So the various boundaries of the nasal cavity, and in that mainly our topic today will be, we will be concentrating on the nasal septum. So the composition, so what are the structures forming the nasal septum, what are the features of the nasal septum, followed by that its blood supply and the nerve supply. So same way as the nasal septum, we will be also discussing about the lateral wall of the nasal cavity. So again, in the same way, what are the structures forming, and mainly the features of the lateral wall of the nasal cavity, and then the blood supply and nerve supply, and finally we will be we will have a brief discussion about the clinical aspects. Okay, now first of all, we all know that the nose is actually a part of the face. It is a pyramidal projection which is present in the face. Okay, so it just projects anteriorly. Now the main parts of the nose will be the root of the nose. Okay, and then you have the tip of the nose. This is the root of the nose, from where the nose starts, or the nasion. The point where the nose starts is actually called as the nasion. That is the root of the nose, and this you have the rounded tip of the nose. So between the root and the tip, this is actually called as the bridge or the dorsum of the nose. Okay, then what happens is, on this dorsum is actually not sharp, but it is somewhat rounded, and on either sides what you see here, these mainly what do you call this is the ala of the nose. Okay, so this lateral widened part is actually called as the ala of the nose, and you have the external nostrils. Okay, so the external nostrils is present medially by the mobile part of the septum, and laterally by the ala of the nose. Now our external nose is also mainly formed by the bones and the cartilages. Okay, so what are the bones and cartilages which mainly form the external nose? So it is partly bony and partly cartilaginous, and especially with respect to the external nose, majority of it is mainly formed by the cartilages only, so which you are able to see here. So mainly two bones contribute for the external nose. One is the laterally is the frontal process of the maxilla, and the other one is the nasal bone. So the frontal process of the maxilla and the nasal bone actually contributes for the bony part of the external nose, which actually fit into the nasal notch. So this picture, what you are able to see is the nasal notch of the frontal bone. These are the three bones. Then with respect to the cartilaginous part, in the midline what you see is the anterior border of the septal cartilage. Okay, so mainly it is the anterior border of the septal cartilage, and then what you see here is the upper lateral nasal cartilage. Okay, so that is the upper lateral nasal cartilage, and then what you see is the lower lateral nasal cartilage. So this lower lateral nasal cartilage is actually called as the alar cartilages. So ala means wing-like expansions on either side, or wing-like. Okay, and then of course it is also substituted by the fibrofatty tissue. So apart from the cartilages and the bones, you also have the fibrofatty tissue. So this is the lower lateral nasal cartilage, and that also has a process sending to the septum called as the septal process of the lower lateral nasal cartilage. Now, all this is actually covered by the skin. The skin over the bones is very much tightly adhered, but the skin over the cartilage is loose. Okay, now coming to the blood supply, it is mainly supplied by the branches of the dorsal nasal artery and infratrochlear branches, all from the ophthalmic artery. Then infraorbital artery, which comes out through the infraorbital foramen, which will also supply the sides of the nose. And then you also have the anterior-inferior part supplied by the septal branches of the facial artery. Then the nerve supply is mainly again by the branches of the infratrochlear nerve. Okay, and then the external nasal nerve. So infratrochlear nerve, and then the other one is the external nasal branch of anterior ethmoidal nerve, and then you have the infraorbital nerve, which is the direct continuation of the maxillary nerve, which is actually going to divide into a palpebral branch, nasal branch, and then your superior labial branch. So these are the nerves which are mainly supplying the external nose. So now let us actually pass on to the nasal cavity. So here you are able to see the nasal cavity, and it is divided by the septum in the midline into two equal halves. So the nasal cavity is divided into two halves, not equal halves, by the nasal septum, because the nasal septum in most of the cases is deviated to one side. It is not exactly in the median plane. It is deviated to one side, and thereby it makes both the halves asymmetrical. Okay, it makes both the half asymmetrical, and that is actually the septum, and this you have the lateral wall of the nasal cavity. On the lateral wall you can see some projections. They are actually called as the turbinate bones. Okay, so turbinate bones are concha. So we will come to it later. Now the cavity extends from the, as I told you, from the nostrils, which we saw in the previous slide, external nose nostrils, to the posterior nasal aperture. Okay, so that is the extension of the nasal cavity, and is divided into two asymmetrical halves by the nasal septum, which is usually deflected to one side. Okay, so that is the nasal septum, and here you are able to see the anterior nasal spine, and this aperture is actually called as the pyriform aperture. Now the nostrils are mainly kept open or patent by the cartilages, and the muscles which are acting on it, compressor and the dilator nerves. Okay, so these muscles again in humans, they are not very much functional. Okay, they are mostly vestigial. So through the anterior nasal aperture, so through the posterior nasal aperture behind, so the posterior nasal aperture is actually called as the cornea. So here you are able to see the posterior nasal aperture. Here we have seen the anterior nasal aperture. So from here to the posterior nasal aperture is the extension of the nasal cavity. So this posterior nasal aperture is also called as the cornea, through which it communicates with the nasopharynx. Okay, that is the posterior nasal aperture, which is 2.5 centimeters in height and 1.5 centimeters width. Okay, and it is mainly bounded below by the hard palate. You are able to see that, mainly bounded by the hard palate, and medially it will be bounded by the warmer, and laterally by the medial pterygoid plate. Okay, and the medial pterygoid plate, and above by the body of the sphenoid. Body of sphenoid, medial pterygoid plate, warmer, and the hard palate, upper surface of the hard palate. They all form the boundaries of the posterior nasal aperture or the cornea. Okay, so vestibule is the anterior-inferior part of the nasal cavity. The most anterior and inferior part of the nasal cavity is called as the vestibule of the mouth. Sorry, vestibule of the nasal cavity, and it presents coarse hairs which is called as the vibrissae. The hairs are actually called as vibrissae. It is lined by skin and it contains sweat glands as well as the sebaceous glands. So this part is actually lined by the skin and it consists of sweat glands and the sebaceous glands, which is the vestibule. The vestibule means a connecting part which does not belong to the any areas. That is not, you cannot consider this under the nasal cavity, or you cannot consider this on the external nose. So before going into the further details into the nasal cavity, you should try to actually understand some basic features of this bone, which is actually called as the ethmoid bone. So this ethmoid bone, which you are able to see in the anterior view, it is a pneumatic bone. Okay, and it forms the bones of the nasal skeleton, facial skeleton. Okay, so why it is called as a pneumatic bones? Because within it contains numerous spaces lined by the mucus, and these spaces are actually called as the sinuses. And since it is present inside the ethmoid bone, it is actually called as the ethmoidal air sinuses. Okay, there are four sinuses which is situated around the nasal cavity. So one is the ethmoidal, which you are seeing within the bone. Okay, same way you have within the sphenoidal air sinus. Within the frontal bone you have the frontal air sinus, and within the maxilla you have the maxillary air sinus. So this is actually ethmoidal air sinus. They are actually lot of small intercommunicating spaces. Since it is lot of intercommunicating spaces, this lateral mass on either side is actually called as the labyrinth of ethmoid bone. Okay, so mainly these two lateral masses are actually called as the labyrinth of ethmoid bone. Okay, because numerous intercommunicating spaces, the ethmoidal air sinuses are present, and they are grouped into anterior, middle and posterior. Then what happens, you see, from this bony labyrinth, medially you are able to see two projections. Mainly the one you are able to see very large projection is one of the turbinate bone, that is the middle nasal concha. Then you also have one more on above, which is called as the superior nasal concha. So superior and middle nasal concha projects medially from the labyrinth of ethmoid bone. Then in the midline you can see a bone, plate of bone which is descending downwards, which is going to contribute for the nasal septum, and that is called as the perpendicular plate of ethmoid bone. Okay, so mainly what you see is the perpendicular plate of ethmoid bone. The two lateral masses are the labyrinth of ethmoid bone, and projections, bony shelf-like projections medially from the labyrinth is the superior and the middle nasal concha. Then above, what you see, this plate of bone is the cribriform plate of ethmoid. This is actually called as the cribriform means sieve-like. It is perforated. So it has got numerous small tiny pores through which the olfactory nerve filaments are transmitted from the nasal mucosa. That is the olfactory epithelium, and actually it enters the brain. Okay, so mainly it transmits the olfactory nerve filaments, that is the cribriform plate. And the midline, what you see, this is the crista galli. Okay, so that is the crista galli, which you would have seen in the anterior cranial fossa, so which also gives attachment to your falx cerebri. So these are the parts, basic features of the ethmoid bone which you should know, because mainly it contributes for the septum. The cribriform plate contributes for the roof, and the labyrinth with its bony projections contribute for the lateral wall of the nasal cavity. So it almost contributes for all the walls of the nasal cavity except the floor. Now first coming to the roof of the nasal cavity. So here you are able to see the nasal cavity from behind, that is the posterior nasal apertures or the coniae. Posterior nasal apertures of the coniae, and that is your septum, nasal septum and lateral wall, all are actually lined by the mucous membrane. From the lateral wall you can see the projections, and that is your the concha, as I told you. So this is actually the floor, and that is your roof. So floor is somewhat concave, okay, and horizontal, and it is actually concave. Roof is actually very narrow, okay. So coming to the roof, it is very narrow. So as I told you, the boundaries, it has got a roof, floor, medial and lateral wall. So you're able to see the roof is actually a very narrow part, okay, not like your floor, it is wide, and mainly it has got three parts: an anterior sloping part, okay, anterior sloping part mainly comprising your nasal bone and your frontal bone. So okay, and then you have your part of nasal cartilage also. So mainly it comprises of your nasal bone and the frontal bones, nasal process of the frontal bones. So anterior sloping part. Then the intermediate part is actually horizontal, okay. The intermediate part is actually horizontal and mainly formed by this cribriform plate of ethmoid, and this part of the roof will be lined by a special type of epithelium, that is the olfactory epithelium, from which the olfactory nerve filaments, they pass through the cribriform plate of ethmoid and they are going to relay in the olfactory bulb. Okay, so this part of the roof, as I told you, is pierced by the olfactory nerve filaments, that is the intermediate part. Then you also have a posterior part of the roof. So that is the posterior part of the roof which you are able to see here. Okay, it is mainly formed by the anterior surface and also the inferior surface of the body of the sphenoid bone. Anterior surface and inferior surface of the body of the sphenoid bone, and this continues with the roof of the nasopharynx. This posteriorly it will continue with the roof of the nasopharynx. Okay, so either side you see the roof part on the lateral cavity, lateral wall, and also on the septum part, because roof comprises of the above and also little bit extends onto the upper part of your septum as well as the lateral wall of the nasal cavity. So that is what the roof and adjoining part of the septum and the lateral wall are actually lined by the olfactory epithelium. So mainly it consists of the bipolar neurons, no? Special sensations. So most of the special sensations you have bipolar neurons. The olfactory epithelium you have. In the retina you come across bipolar neurons. Okay, even in the organ of cortex or sense of hearing you come across. So mainly bipolar neurons are actually characteristic feature of the special sensations. So now coming to the floor of the nasal cavity, you are able to see again the floor, which is mainly formed by the upper surface of the palatine bone. So mainly formed by the upper surface of the hard palate. So you know the bones forming the hard palate we just saw in the previous lecture. So anteriorly it is formed by the palatine process of maxilla, and this is the horizontal plate of palatine bone. So that bone, hard palate, superior surface, and in the midline you have the crust, the nasal crust. Okay, so it is actually horizontal as well as concave from side to side, and from the lateral wall you can see the turbinates projecting into the nasal cavity. Okay, so that is the floor which actually extends from the tip to the posterior nasal aperture, and on the floor here you are able to see the incisive fossa. No? Above that the mucous membrane shows a small papillae on the floor. Okay, so the mucous membrane over the incisive canal. Anteriorly you are able to see the incisive fossa. So there on the incisive canal on the upper side you see a small slight depression. So now we will come to the nasal septum. So which actually forms the medial wall. You can consider it as the medial wall. It is, as I told you, it is usually deflected to one side and it is not exactly in the median plane. Okay, so it is mainly made up of the bones and cartilages. Okay, so what are the bones which are mainly responsible for the formation of the nasal septum? So the main two bones which contributes for the major part of the nasal septum is your perpendicular plate of the ethmoid bone. So here you're able to see that is the perpendicular plate of the ethmoid bone, and the other bone which you come across in the nasal septum is the vomer. So these two bones mainly contribute for the nasal septum. So other bones, mainly apart from the perpendicular plate and the vomer, small bones, what you are able to see here is the nasal bone. Okay, so you come across the nasal bone and part of the frontal bone. Okay, so that is the perpendicular plate of ethmoid for you, which will actually communicate antero-inferiorly with the septal cartilage. Okay, and then what happens is posterior-inferiorly it will communicate with the vomer, and posterior-superiorly it actually communicates with the crest of the sphenoid. Okay, and above it is mainly formed by the cribriform plate of ethmoid. Okay, so antero-superiorly you have the nasal and the frontal bone. Okay, so that is the nasal and the frontal bone, and then you have the crest of the sphenoid or the sphenoidal crest, which is it through which it communicates with the perpendicular plate, actually communicates with the crest of the sphenoid. Same way from the undersurface you also have another projection which is called as the rostrum of the sphenoid, which will actually articulate with the vomer. Okay, which will articulate with the vomer. The vomer is a bone which is ossified in membrane and it is bilateral. How we confirm it, this bone is actually not a single bone but bilateral, which has fused is the upper part, the vomer will actually diverge to form the ala of the vomer, and between the two diverging parts this rostrum of sphenoid will actually go and fit into it. Okay, so these are the major bones forming the nasal septum. This is your perpendicular plate of ethmoid, vomer. Okay, and other accessory bones are part by the cribriform plate, nasal bone, frontal bone, crest of the sphenoid and rostrum of the sphenoid. The posterior border of the vomer is actually free and it contributes for the medial wall of the posterior nasal aperture or the coniae. And this will go and actually again articulate with the nasal crest of the hard palate. Okay, so next we will pass on to the cartilages. Okay, so two main bones, as I told you, perpendicular plate and vomer forms the anterior-superior, and other one is the posterior-inferior part, and they are all supplemented by these accessory bones. So cartilages mainly form the anterior and inferior part of the nasal septum. What are the main cartilages is the septal cartilage, which you are able to see, mainly forms the major anterior part, and that receives the septal process of the lower nasal cartilage, which is your alar cartilage. Because alar cartilage you come across only on the lateral wall, it gives a septal process through which it articulates with the septal cartilage. So mainly septal cartilage and the alar cartilage, septal process of the alar cartilage, lower nasal cartilage. Okay, then between the actually the vomer bone and the septal cartilage, you sometimes come across vomeronasal cartilage. There you see a blind pouch which is extending above, and that is called as the vomeronasal organ of Jacobson's organ. Okay, so this is again supplied by the olfactory nerves. So this is mainly supplied by the olfactory nerves, and it is vestigial in humans but very well developed in macrosomatic animals. Okay, so through the smell, mainly which can detect whether any strange person is there. So mainly macrosomatic animals, it is very well developed. That is the as I told you, the Omaro nasal organ of Jacobson. Now let us come to the blood supply of the nasal septum. So the blood supply of the nasal septum, anterior superior part, you see branches from the anterior ethmoidal branch of the anterior ethmoidal branch of the ophthalmic artery. So that mainly supplies the anterior superior part. Okay. Posterior inferior part is by the sphenopalatine artery. Sphenopalatine artery will divide into medial and lateral nasal branches. Medial nasal will supply your nasal septum. Okay. Sphenopalatine artery. Then here one more artery you have, anterior inferior part, that is mainly by the septal branch of the facial artery, superior labial branch of facial artery. Okay, and sometimes it will also the greater palatine artery will supply, but mostly it is the anterior ethmoidal, sphenopalatine, and then the superior labial septal branch of the facial artery supplies the septum, nasal septum. It might also be contributed by the posterior ethmoidal artery also. Now, anterior inferior part of the septum, we have the anastomosis of three arteries. So mainly they are the greater palatine, sphenopalatine, and facial artery. So it is mainly the greater palatine artery which is going to come and through the incisive canal. So that is the greater palatine artery coming. Sphenopalatine and facial artery, they anastomosis, rich anastomosis, and that area is called as the Kisselback's area or the Little's area. Rich anastomosis is there. So next, coming to the venous drainage. So the mainly anterior superior part drains into the superior ophthalmic vein. Okay, so mainly it drains into the superior ophthalmic vein. Posterior inferior part, they go via the pterygoid plexus. Okay, so these veins mainly go to the pterygoid plexus. Mobile part of the septum, mainly through the facial vein, goes to the internal jugular vein. Okay, so mobile part of the septum, internal jugular vein. This part of the septum comes around the dangerous area of your face, lower part of the nose and the upper lip. So any infections from here might actually, since the facial vein has communications with the deep facial vein through pterygoid venous plexus or mainly through the superior ophthalmic vein, it might infect your intracranial dural venous sinuses. Sometimes veins in the upper part of the septum accompany the olfactory nerves, drain into the inferior cerebral veins. Occasionally a vein through the foramen cecum might drain into your sagittal sinus also. That is the superior sagittal sinus. So through the veins, actually these veins pass via the pterygoid venous plexus into the cavernous sinus. Those are superior ophthalmic veins. So facial vein to the internal jugular veins. Okay. Now sometimes what happens is sudden severe bleeding in elderly hypertensive patients might be due to rupture of these venous communications. Okay, so that is the superior ophthalmic veins or through the via the inferior cerebral veins. So thereby these rupture is actually a safety phenomenon to reduce the increased intracranial pressure. So when these veins rupture, you see bleeding from the nose. So lymphatics mainly drain into submandibular nodes and retropharyngeal nodes. So now coming to the nerve supply of the nasal septum. So the nasal septum mainly it is supplied by the upper part near to the roof. It will be supplied by the olfactory nerve filaments. Okay, the remaining part, the respiratory zone, is actually supplied mainly by the nerves which carry the general sensations. So anterior superior part is by the ethmoidal branch, anterior ethmoidal branch. Okay, so that actually supplies the anterior superior part. Then intermediate part is by the sphenopalatine branch, long sphenopalatine nerve. Okay, and then you also have branches from the greater palatine nerves. Okay, and then anterior superior alveolar nerves also supply the anterior inferior part close to the floor. So mainly it is the ethmoidal, anterior ethmoidal nerve, sphenopalatine nerve, greater palatine nerve, and also by the anterior superior alveolar nerve, which is actually a branch from the maxillary nerve which passes through the orbital canal. So it gives this anterior superior alveolar nerve. So with this we have completed the nasal septum. So mainly the bones forming the nasal septum and your blood supply, nerve supply of the nasal septum. Now we will actually pass on to the lateral wall of the nasal cavity. So what are the bones forming the lateral wall of the nasal cavity? So mainly you come across three shelf-like projections. They are the superior, middle and inferior nasal concha. Okay, the superior and the middle are actually the part of the labyrinth of ethmoid board. So that's why I discussed about the ethmoid board in the beginning of this class itself. Okay, so mainly you have the superior and middle concha, which is a part of the labyrinth of the ethmoid bone. So then you have the inferior nasal concha, which is a individual bone. It is not a part of any bone. So it is a separate bone. It is actually the largest of these three conchas, inferior nasal concha. Then you have the perpendicular plate of palatine bone. This is your hard palate, which is mainly formed by the maxilla and the palate behind. So perpendicular plate of palatine bone, and then more posteriorly you see the medial pterygoid plate. Okay, so you see the medial pterygoid plate. Then in the front mainly it is contributed by the lacrimal bone. So you are able to see that is the lacrimal bone, frontal process of maxilla. So frontal process of maxilla, then you see the lacrimal bone, nasal bone. Okay, so nasal bone, frontal process of maxilla, lacrimal bone, superior, middle and inferior nasal concha, perpendicular plate of palatine bone, medial pterygoid plate. Okay, so these are all the bones which are mainly forming the lateral wall of the nasal cavity. And anteriorly, again, the lateral wall is also supplemented by the cartilages. So the main cartilages are the lateral process of the septal cartilage, like how the lateral nasal cartilage has the septal process. Here you have the lateral process of the septal cartilage. Then you have the lateral nasal cartilage, and then the lower alar cartilage. Lower nasal cartilage is actually called as the alar cartilage. Then you have small minor cartilages also. So these are the bones and the cartilages forming the lateral wall of the nasal cavity. So now, what are the features on the lateral wall of the nasal cavity which we are actually going to discuss? So first, mainly, I told you three shelf-like projections you come across. Okay, they are the concha. So before that, let us try to understand the other features. So mainly, you see the vestibule. Okay, so anterior-inferior part which is lined by skin and vibrissae. So these vibrissae, what is the difference between vibrissae and the other part hair distribution in our bodies? They are short hairs, one thing, very short, and they are very tough hairs. Okay, so they are somewhat tough, not very soft. And then next you see this area in front of the inferior nasal concha or meatus. Below the concha you have a spaces called as the meatus, the atrium of the lateral wall. Okay, so in front of the middle meatus you see the atrium or lateral wall. Above it will be limited by a ridge of the mucous membrane called as the limen nasi, and below you see a mucocutaneous junction because vestibule is lined by skin, and exactly when you go into the lateral wall it is the mucous membrane. That mucous cutaneous junction is actually called as the agar nasi, and this is actually called as the limen nasi. Limen meaning is entry point. So you also come across a limen insula in the brain. Limen means entry. So that is actually considered as the entry point into the lateral wall of the nasal cavity. Limen nasi is a this is not a mucocutaneous junction, only the agar nasa is a mucocutaneous junction. It is present between the vestibule and the lateral wall, or the atrium part of the lateral wall. Okay. So major features what you come across is the concha, or they are also called as the turbinates or turbinate bones, which are shelf-like projections seen somewhat bit posterior because they are behind the atrium. Okay, three conchas you have: superior, middle, and inferior nasal concha. So, superior, middle, and inferior nasal concha. So, the first two, superior and inferior, are part of the labyrinth of ethmoid bone, and the inferior nasal concha is actually an individual bone and also the largest of the three concha. So, all these bones are actually lined by the mucous membrane. They are actually lined by the mucous membrane. Now, why they are actually called as turbinate bones? Because when the air is actually inhaled, so mainly what happens is they pass below this shelf-like projections. Okay, so when these passes inside these shelf-like projections, due to the pressure, what happens is when you inhale, naturally a mild pressure is created, and when these passes through these projections, it will create a turbine force. So the air will actually circulate inside this or under these self-like projections, and these turbine force will make the inspired air warmer, and they will also humidify the inspired air. Okay, so that is the main function of these conchas or shelf-like projections. Okay, so below this or underneath these conchas, you see the spaces which are actually called as the Biatus. They are regions or spaces underneath this concha. So you have inferior Biatus, middle Biatus, and superior Biatus. So various structures open into these Biatuses. So we will try to see what are all the structures opening into this Biatus. Now first, the inferior concha has been cut and removed. So now you are able to view the inferior Biatus with the space underneath the inferior concha. Okay, so in the inferior Biatus, mainly one structure opens is the nasolacrimal duct. So that is the inferior concha, the largest of all. So deep to that in the inferior Biatus, you are able to see a probe has been introduced. So mainly what is the nasolacrimal duct opens into the inferior Biatus. So nasolacrimal duct actually drains your lacrimal fluid. So what are all the tears which are created in the lacrimal gland, they will actually brought here to the lacrimal sac, and through the lacrimal punctum, papillae, then through the nasolacrimal duct, they are drained into the inferior Biatus. So structure opening into the inferior Biatus is the nasolacrimal duct. The next, middle Biatus. So below the middle nasal concha, what you see is the middle Biatus. The middle Biatus, mainly you see a bony projection, a bulging, which is actually called as the bulla ethmoidalis. Okay, so the bulla ethmoidalis is a round elevation, and that elevation is mainly formed by the middle ethmoidal sinus. The middle ethmoidal sinus opens actually in the bulla itself or sometimes below it. Okay, so what you see is the rounded bony bulge called as the bulla ethmoidalis, which is formed by the middle ethmoidal air sinus. Now below the bulla, you see a semilunar groove or sulcus that is called as the Hiatus Semilunaris. Okay, so that is the bulla ethmoidalis where the middle ethmoidal air sinus opens. So next, as I told you, Hiatus Semilunaris is a semilunar sulcus below the bulla ethmoidalis. So structures opening in the anterior part, it will receive the anterior ethmoidal sinus, and the maxillary sinus opens into the posterior part of the Hiatus Semilunaris. Okay, so because that opening or sulcus is in a semilunar shape, it is called as the Hiatus Semilunaris. And if you trace the Hiatus Semilunaris anteriorly, it will have an extension called as the infundibulum. It is somewhat funnel-shaped passage that receives the opening of your frontal sinus through the frontonasal duct. Okay, so the frontonasal duct actually drains the secretions of the frontal sinus. So mainly your middle meatus has lot of openings. Bulla ethmoidalis has opening of middle ethmoidal sinus. Hiatus semilunaris has the opening of your anterior ethmoidal sinus and the maxillary air sinus. Anterior part of the hiatus semilunaris is infundibulum, continues as infundibulum, which receives the opening of the frontonasal duct, which is the draining passage for the frontal air sinus. This is frontonasal. This is actually nasolacrimal duct, the inferior meatus. So here you are able to see the bulla with the opening of the middle ethmoidal air sinus, hiatus semilunaris, which has the opening of maxillary air sinus, anterior ethmoidal sinus continuing as the infundibulum, nasolacrimal duct through which the frontal air sinus will actually open. Then superior meatus, you are able to see here, that is the superior meatus below the superior nasal concha. So what are the structures opening into the superior meatus is your posterior ethmoidal sinus. So all the sinuses are actually draining into the lateral wall of your nasal cavity. Okay, so that is the posterior ethmoidal sinus. Now above the superior meatus, you see this space is called as the supreme meatus or sphenoethmoidal recess. So this space above the superior meatus is actually called as the supreme meatus or sphenoethmoidal recess, which receives the opening of sphenoidal air sinus. Okay, so structures opening into the supreme meatus, or it is also called as the sphenoethmoidal recess, receives the opening of the sphenoidal air sinus. So below the inferior meatus, below the inferior concha, the inferior meatus, nasolacrimal duct. Middle meatus, middle ethmoidal, anterior ethmoidal, maxillary and frontal. Superior meatus, posterior ethmoidal sinus. Supreme meatus or sphenoethmoidal recess receives the opening of the sphenoidal air sinus. So now coming to the blood supply or arterial supply of the lateral wall, it is mainly supplied again by the branches from the anterior ethmoidal artery, anterosuperior quadrant. Actually, certain books divide into 4 quadrants for easy understanding, but there is no hard and strict rule, because definitely most of these arteries they overlap. So just for the sake of understanding, anterosuperior quadrant is by the anterior ethmoidal artery, anteroinferior quadrant is by the anteroinferior quadrant is by the facial artery and greater palatine arteries. Posterior-superior is by the sphenopalatine arteries. Okay, and anteroinferior part, as I told you, greater palatine and facial arteries. And behind posterior-inferior quadrant is again by the greater palatine artery only. So thereby it can be divided into 4 quadrants. Okay, so this you have to definitely memorize, no other go. Next, veins, plexus, which is situated beneath the mucus, drains via the facial, pterygoid and pharyngeal plexus. This we have already discussed in the septum. So next, coming to the nerve supply. So again the lateral wall nerve supply, anterosuperior by the anterior ethmoidal nerve, okay, which is a branch from the nasociliary nerve. And then anteroinferior quadrant by anterior superior alveolar nerves, which is from the maxillary nerve. And then posterior superior quadrant is by the sphenopalatine nerve, which is coming to the sphenopalatine foramen. Okay, and then posterior inferior quadrant is by the greater palatine nerve. Okay, so this greater palatine nerve actually through which it will supply when it passing the greater palatine canal. So these are mainly the nerves, they carry the general sensations. Apart from that, the adjoining area of roof, you have the olfactory nerve which carries the sense of smell. Then apart from that, you have sort of glands, nasal glands, mucous glands as well as the serous glands. Okay, so they have their parasympathetic nerve supply from the pterygopalatine ganglion. So for a detailed description of this, kindly refer to my maxillary nerve and maxillary artery lecture. So in that I have discussed about the pterygopalatine ganglion. So mainly branches from your lacrimatory nucleus, facial nerve, geniculate ganglion, from that greater petrosal nerve, and then to the nerve of the pterygoid canal, reaches the pterygopalatine ganglion. From the pterygopalatine ganglion branches pass via the branches of these ganglion via the greater palatine and also sometimes via the sphenopalatine nerve to supply the glands of the nose. That is parasympathetic, sorry. Sympathetics will mainly actually come from the superior cervical ganglion. Okay, so they mainly will come through the superior cervical ganglion, pass through your branches of your external carotid artery. Okay, and they might reach your what do you call the glands. Okay, so vasomotor, they are actually vasomotor, and mainly preganglionic fibers are from the upper thoracic segments of the spinal cord. Okay, so that is about the lateral wall of the nasal cavity. So mainly what are the functions? So far we have actually seen about the septum and about the lateral wall. So main function is olfaction, olfactory epithelium. You have the olfactory nerve filaments. Okay, then so that is your olfactory zone, the roof and the adjoining area of the septum and the lateral wall. Then more anteriorly, this vestibular zone you have, and then the remaining is the respiratory zone. So lined by pseudo-stratified epithelium, consists of lot of mucus and serous glands. Their main function, the inspired air is actually conditioned. So they make the air warmer. They also make the hair humidified, and these mucus secretions helps to trap any foreign particles. That foreign particles through the beat of the pseudostratified epithelium is actually passed on to the nasopharynx, and they might be expelled through coughing or sneezing. That is one protective mechanism. Same way here, this vibrissae itself, short, tough hair, as I told you, they filters the dust particles. Okay. Apart from that, the nasal cavity also receives the opening of sphenoidal air sinus. They are mainly responsible for producing the resonance to the voice and reducing the weight of the skull. Okay, so that is the functions of the nasal cavity. So coming to the clinical aspects, mainly the deviated nasal septum. I told you that most of us have the nasal septum which is deviated. It is not exactly in straight line in the median plane. But for some people, the deviation might be more severe and it might lead to nasal obstruction. So congestion, nasal congestion, when it is more severe, causing snoring or frequent sinusitis or breathing difficulties, then they go for SMR or submucous resection or septoplasty, a surgical procedure. Okay, so that is called as the septoplasty. Then rhinitis, so definitely we all will experience rhinitis, that is nasal inflammation of the mucosa leading to blockage of the nose, and it is characterized by sneezing and watery discharge, which is actually called as the running nose. Okay, running nose or watery discharge, but the exact term for the discharge is actually called as rhinorrhea. Okay, that is actually called as the rhinorrhea. So this rhinitis might be due to virus infections. So it might be due to infections or allergic rhinitis. So to certain factors, certain people are allergic. So when they are exposed to dust, when they are exposed to pollens, and they are exposed to cold climate, all these might bring about allergic rhinitis. Okay, so rhinorrhea is actually discharge, which we call in common term as the watery discharge, as the running nose. Now sometimes what happens, you also have called a CSF rhinorrhea. So if there is a fracture on the base of the skull, then CSF might actually through the cribriform plate will actually discharge as a rhinorrhea, which is called as the CSF rhinorrhea. Then what you have is the epistaxis. So Kisselbach's area or Little's area, where you have rich anastomosis of these three arteries, as I told you. Mainly they are the sphenopalatine, greater palatine, and the septal branch of the facial arteries. So that area, what happens is that Little's area is damaged. Okay, any trauma, any blow or trauma to that, or sometimes any injury, what happens is lead to profuse bleeding. So bleeding is actually called as epistaxis. So visualization is through a nasal speculum called as the rhinoscopy. It might be anteriorly or sometimes posterior rhinoscopy. You actually place a mirror in the pharynx and then tend to see the posterior part of the nasal cavity. So that is all for today's class, and thank you very much for your patient listening.